we have Dr. Venkatesh Thuppil to chair the session, the keynote session of Dr. Malathi. And Dr. Venkatesh Thuppil needs absolutely no introduction. He is a person whom we all love and admire, and he is well known as the lead man of the country. For all of those people who don't know, he was one of the persons instrumental in bringing the unleaded petrol that we use. And he is an iconic figure, let me tell you, ladies and gentlemen. If I start talking about him, we will not have time for Dr. Malathi. So I hand you over to Dr. Venkatesh, sir, to please start the next session.
Thank you, Dr. Vijay, for your kind words. I don't deserve all that. It is the team which worked. Anyway, I'm extremely happy. I tell you, I'm delighted, honored to introduce my very dear friend, Dr. Malathi, because my association with Dr. Malathi is from NABH times, and she was so kind, very concerned, and very hospitable. And Dr. Malathi is the keynote speaker today on digital adoption in hospitals with her rich experience. Dr. Malathi is Chief Quality Officer, Chief Medical Officer, India and GCC countries for Aster DM Healthcare. Has served as Head Medical Services and Quality for 14 years at Manipur and Wokhar. I implemented JCI, Canadian accreditation, Dubai accreditation, NABH across Aster DM, and an advisory board of Canadian and Australian Standard Committee. A stalwart in the field. Over to you, Dr. Malathi. We are all looking forward to listen to. And one more thing I showed you, she's one of the greatest singers, Carnatic classic. I tell you, every time we meet her, I make her sing one song. Thank you, Dr. Malathi. Over to you.
Thank you so much, Dr. Thuppil. It is indeed an honor. I was delighted when I got to know that you are the chairperson. And yes, you're absolutely right. You've been such a great mentor. Thank you for this wonderful opportunity. I have a very, very interesting topic. Digital adoption, a game changer in the hospitals. So I start off by saying the digital front door, which I think in great detail Parag was talking about, is open. And we all ought to remember that it is no longer an option. It is something that we believe is to connect, to gain trust, and finally guide people, because everybody is waiting. Everybody is like a sponge now to take up this digital adoption. Therefore, the three important aspects that I'd like to stress upon, which I call as the digital health priorities, principles, and the focus. The entire adoption, number one, what is the priority? And that is, it should be an integral part of all the healthcare providers and benefit people in a specific way. It should be developed with very, very stringent principles, and there has to be a focus. So let me talk about each one of them. That is, when we say it should be an integral part of the health priorities, and what does that merely mean? It means, is it ethical, safe, secure, reliable, and very important, equitable and sustainable? At the same time, when you talk about the principles, what does this mean? Transparency, accessibility, scalability, replicability, interoperability, privacy, security, and confidentiality. These become the principles. And at the same time, the focus should be in this adaptation, improving performance, productivity, efficiency, security, and there should not be any sacrificing the reliability or accessibility. This is, in a nutshell, what encompasses digital health. Therefore, the importance of this, which was touched upon by Parag also, and that was on the economic part of it, and what has digital health got to offer? But we ought to remember the importance of health economics is to formulate efficient health services. Therefore, having said that, what does digital health offer? A seamless experience and urgent care. To establish the true cost of delivery of the health care, which means your digital health does it make it affordable to patients? The third important, evaluate the cost and the benefit. Does the consumer believe that there is value added benefits? Last but not the least, very, very important, what is the effect of the economic variables, time, distance, cost of accessibility? And that means, are we providing continuity of care? Is there remote monitoring? Can we bring it to the homes of the people and telehealth? All of this has to match with the health economic and bringing the benefits of digital health. Therefore, there is now a seismic shift in the healthcare, and that is because of the global pandemic, exponential advances in medical sciences, explosion of digital technology, data analytics, all of them play an important role. Next, please. And along with it, informed, empowered customer. What has driven digital adaptation is very, very important. Consumers are informed. They ask you, what is the digitization in your hospital, which has brought about this shift. Important aspect, friends, before I go into the second part of my presentation is to believe, and I reiterate, the global pandemic has been the catalyst to kickstart, to accelerate the large number of changes in the healthcare system. And that has brought about unfathomable, calculable impact, which has actually driven the way towards digitization. Next, please. Yes, this is a very interesting slide. Friends, I'd like you to look at the three important keys which are shown here, and the specific one that I'd like you to look at, what has happened in digital health trend. The green one is what is very, very important. And as you can see at this point in time, the areas of importance are the 3D bioprinting, the important biomarkers, artificial intelligence, which has come into the drug designing, lab test, very important in diagnostic, portable diagnostic, augmented reality in case of surgeries, chat box, employees programs, digital health services. This is the way the entire hype cycle has come in, with all of these emerging because of the pandemic. Therefore, this is what you can see, what has happened. The COVID-19 crisis has accelerated the digitization of customer interactions. It is very, very clear of what you can see probably in 2017, with interactions being 20, going up to 58%. So on and so forth. In Asia Pacific zone, from 22%, it has become 53%. 18 in Europe to 55, from 25% to 65%, and that has become interactions. Along with it, the leap in digitization is how much of it has become actually digitized. Globally, from 29%, we have reached 55% as the acceleration in digitization. Asia Pacific from 31 to 54%, and from 26 to 50%, and so on and so forth. Therefore, this has paved the way of digitization and adoption. This gives you an idea how much has been in the growth in the telehealth that has happened, which has peaked, as you can see, towards 2021. And that is what has caused this dynamic rise in digitization, and the expenditure, which has gone in very, very high, as you can see here, from just about $0.2 million to where it has reached. So we can all understand the impact that has happened with digital adoption. This is a very interesting one before I take up what it means to the hospital. The percentage of respondents who used digital health, and now you can see what has happened prior to COVID, where it was at 17%, zoomed to 47%. So friends, you can understand what has happened to the need for digitization when I said it has become consumer driven. Now, those who started using telehealth, how much will they use it in the future? Very, very interesting to see. Only 12% still said we are not too sure. but 25% said we will use telehealth, but 63% said we will move into a hybrid model. Friends, the rest of my slides therefore focus on why digital adoption is a game changer for the hospitals to survive. Therefore, digital transformation and innovation is the need of the hour, and this was just a prelude to say why and how all of this has come into happen. Let's look at it has become an accelerator. What is this accelerator? A large number of digital healthcare and medtech startups have come into picture. There is a huge total corpus that has been created, and research-driven program, AI programs have come into play. The digital adoption resulted in digital healthcare and therapeutics, addressing challenges along with affordability. Digital adaptation, which has resulted in biotechnology, biopharmaceuticals, medical devices, and finally, last but not the least, artificial intelligence and deep technologies. Now we all will agree why the adoption has become imperative and almost mandatory. Having talked about this, we at this point in time are talking about digital adoption. So I'm going to focus a lot from the healthcare perspective, and that is digital therapeutics softwares where there is applied virtual reality. Very important, digital companions, a large numbers of what we use in patients have become digi-inhalers, informed decisions and care management, nanomedicine, nanorobots to detect and repair infections at the molecular level, and genomics, which is creating what is a predisposition using DNA technology. Now, this is the very high-end type of digital adoption. At the same time, it's very important when I come on to what is clinical excellence. What has this adoption meant to every hospital? And that is, equipments have become integrated with the HIS system. Clinical alerts that what Parag mentioned and touched upon, triage alerts, faster diagnosis, it has become a powerful tool. All the equipments that you see on the screen, whether it is a point of contact testing, glucometers, CTGs, ECGs, all of these have resulted in being integrated and readily available, which you will see in the next slide. And therefore, what has been adopted in the digital technology? Barcoded administration, and you can see the pictures there. This is what you see in a barcoded administration, simply detecting it. The most important aspect is reducing medical errors. The barcoded sample selections, very important, transfusions, breastfeeding, all of them have become barcoded, and directly the nurse is able to render safe medication. Devices using the checking of vitals, whether it is a simple weight and height capturing devices, have all been integrated with a HIS system where there is no question of any writing to be done and you get the direct data. Service management requests. The patients at the hospitals have a QR code, and you just access the QR code. You can access what are the services you require, which means where are we heading to? And the answer is smart hospitals. That is what is digital adoption all about. And what does smart hospital mean? You are delivering smart care. And what does smart care entail? You become a HRO. And what does it stand for? High reliable organizations. That is how the whole digital adoption culminates in. With that, a few examples have been speech-enabled text, and that is what has been the need of the hour. Most hospitals have adopted this so that they dictate and it starts writing, thereby decreasing the time for documentation. Very, very important. Self-services, patient pathways integrated into the HIS, voice-based analytics which happen automatically, the results come into it by just talking through a voice mechanism, and robotic process automation. Friends, these have become the in thing in adoption in hospitals, and very many of them are simple. In fact, many of them are done by the IT departments themselves. They are all created. They are not necessary, they are bought, and that's what we are relying on. All of these have been created by the IT department with small little software. A team of youngsters work together, and they find that adoption has become extremely easy. These are the adoptions that have happened in a smart hospital. Feedback has become totally digitized. The chat box, a large number of them are QR operated. You just have to tell your patients to scan the QR codes. You get the service you want, whether it is lab reports, whether it is booking your appointment, whether it is just that you want to give a reminder, you have the chat boxes. The e-consult model, you have to click on them, you get your consultation. And finally, the remote monitoring system, small apps, ECG, all of these are given to the patients. The patients at home relay them, which are easily visible to their treating doctors to give them the immediate required advice. That brings us to high-end smart care. This is what I said, that all of these culminates in a smart care, which is called as a smart hospital, augmented virtual reality, remote monitoring, smart homes. I'd like to talk a little, and maybe in the next slides too, the smart homes. Time has come where the patients, probably we have learned through COVID times, when they couldn't reach us, and we said, we will reach you. And that created the smart home applications, artificial intelligence, drones coming in a big way, digital healthcare and telemedicines, which means a full spectrum of digital care begins. The primary care, the chronic care, the specialty care, complex care, the post-discharge care, and finally, preventive care. Each one of them has learned to adopt digitally, and that has resulted in monitoring the patients much more accurately. And that is why it has become digital adoption, I say, is the vision. The vision of healthcare comes to the patients. The hospital has started focusing on acute critical care and complex care, whereas the non-complex care is brought to the patients through virtual hospitals, and that is through technology platforms, centralized telemedical doctors and nurses, hospital at home, decentralized community-based providers, as well as primary care. The hospitals now can take care of a more complex and acute care, which is the need of the hour, and shift the rest. And this shift is possible only by digital adoption. And that is what I said by saying smart cities have evolved. Smart cities to make healthcare smarter. And that is through sensors, technology, data collection and analysis. Data has become integrated to share between various countries, real-time responses to crisis, and very important, the focus now moves towards wellness. At this point, before I end, I'd like to talk and say one word on metaverse. Metaverse is evolving, and it combines all the technologies of artificial intelligence, virtual reality, augmented reality, Internet of Medical Devices, the intelligent cloud, and robotics. This is the way forward. Take us some time, but we ought to start thinking and become partners in the vision to adopt this. And therefore, this was mentioned upon why the focus. The Ayushman Bharat Digital Mission is an endeavor in this direction to create the seamless online platform that will enable interoperability within the digital healthcare system. And therefore, the conceptualization is just digital building blocks. A lot of this is now envisaged and is going to become the mission and the vision for all of us in the healthcare providers, where each digital block is a building block and becomes digital public good that can be used by any entity, and that will be the Ayushman Bharat digital mission, which everybody is now focusing on. And therefore, to enable this, there is only one thing that matters, and that is patient-centered care. And the question that is asked, when a patient is asked, what are you looking for? Because he or she is the consumer. Whatever you adopt has to be decided by that one person writhing in pain in the hospitals or at home. And if you ask the question to the patient, what do I want and what can I do for you? And the answer by every patient is, be there for me when I need you, and tell me when and how do I need to take action. So friends, I just end by saying, if this is what the patient wants, and that is what we need to give them to them at this point in time, the answer is digital adoption. And that is probably, I come back to the title of my own presentation where I said, digital adoption, the game changer. Thank you very much. Thank you, Dr. Agarwal. Thank you, the entire CAHO team, for giving me this wonderful opportunity. And thank you, Dr. Thuppil Venkatesh, for being there to chair this session. And it means a lot to me. Thank you.
Thank you, Dr. Malathi, for a wonderful presentation. You have opened a new arena. What was going on in my mind in future, when I am about to get sick, even before I realize I'll be taken care. The way you projected, the way you have visualized, the way you have convinced that all of us are convinced that even before we fall sick, we will be taken care tomorrow. This is the great digital transformation in future to take care of everyone, young or old. Thank you very much. It was a wonderful presentation, blending the technology advances in UAE to our Indian scenario. Fantastic. Thank you very much. I would like to thank Dr. Vijay Agarwal and CAHO for giving me this opportunity to learn from you. The chairperson learns a lot. I thank you, Dr. Malathi. Great teacher. I have learned from you. Wonderful. All the best.